Hello, this is Sophie Lavoie. I'm an editor with the New Brunswick Media Co-op, and I'm reporting from Fredericton. A researcher at the University of New Brunswick says that harmful misinformation about abortion has been allowed to flourish in this province. Sociologist Tobin LeBlanc Haley recently presented her research, conducted alongside Christine Hughes, as part of the Feminist Lunch Series at UNB Fredericton.
And the persistence of this misinformation is unfortunate, as a lack of clear knowledge about where, how, and what it means to have an abortion can frustrate patient decision-making and cause unnecessary stress and anxiety.
The New Brunswick Media Co-op is sharing a version of the talk as a part of Sexual Health Week to help push back against misinformation in our communities. Full disclosure, LeBlanc Haley is also a member of the New Brunswick Media Co-op's board of directors, and I'm part of the advocacy group Reproductive Justice New Brunswick. LeBlanc Haley said misinformation includes myths about the moral character of abortion patients, health risks associated with abortions, paths to access the service, and the motivations of clinic-based abortion providers. One of the most disturbing results of the study, she said, was that some research participants believed that there was zero access to abortion in the province. Abortion services do, however, remain limited in New Brunswick. When the Liberal Party defeated the Progressive Conservatives in provincial elections in October, one of Premier Susan Holt's first moves was to repeal Regulation 8420. That regulation made New Brunswick unique in Canada for restricting Medicare-funded procedural abortions, also called surgical abortions, to hospital settings only. Clinic 554, which was the only procedural abortion provider in Fredericton, was forced to shut down last year due to financial pressures. 3 hospitals in New Brunswick offer procedural abortions, 2 of them in Moncton and 1 in Bathurst. So-called medical abortions are also available using the abortion pill Mifid Gizmo. LeBlanc Haley also discussed issues including the racist grape replacement theory, which involves the claim that abortions are part of a conspiracy to displace white people as the majority in countries like Canada and the United States. We go now to uncut footage of the presentation by LeBlanc Haley titled Noise and Silence, Exploring Abortion Misinformation in New Brunswick.
Hello, my name is Tobin LeBlanc Haley, and I am an assistant professor of sociology at the University of New Brunswick on the St. John campus. And I'm also on the board of directors of the MB Media Co-op. And I'm coming to you from the unceded and unsurrendered territory of the Wolastoqey to share with you some research that I have done on reproductive health care in the Maritimes, and specifically about the myths and misinformation that are circulating about abortion and abortion access in New Brunswick. And I wrote this paper and this presentation with my colleague, Christine Hughes, who was unable to participate in the presentation of this work. And I'd like to note that this is a recording of a talk that was given at the Women's Center at the University of New Brunswick last week. In November of 2024, newly elected Liberal Premier Susan Holt repealed Regulation 8420 Schedule 2A1 of the Medical Services Payment Act, which had limited Medicare funding for procedural abortions unless, and this is a quote, the abortion is performed in a hospital facility approved by the jurisdiction in which the hospital facility is located. And so what this means, in effect, is that until the repeal of 8420 at the end of last year, Medicare funding for procedural abortions, which are sometimes called surgical abortions, was limited to a hospital facility, meaning that there was no Medicare funding available for procedural abortions performed in freestanding clinics. With the closure of New Brunswick's only freestanding abortion clinic in January of 2024, so almost exactly a year to this talk, the necessary administrative work of establishing appropriate billing processes hasn't been quite worked out yet in terms of understanding how it is that with the repeal of 8420, providers are going to be able to bill Medicare for procedural abortions provided outside of hospital clinics or hospital facilities. We have yet to see the immediate effect of this change that the whole government ushered in. However, the repeal of Regulation 8420, Schedule 2A1, creates the opportunity for providers to bill Medicare for those procedural abortions performed outside of hospitals. And there has been some suggestion that access to procedural abortion will be provided through some of these collaborative healthcare clinics, 30 that the Liberal government has promised to establish by 2028, so that procedural abortion care will be provided in some of these 30 clinics. Premier Holt's regulatory change is the latest in a series of shifts in abortion policy and practice in New Brunswick in the last decade. And these shifts include the 2015 changes to Regulation 8420, which removed the so-called two-doctor rule, the very important rollout of Medicare coverage for mifepristone in 2017, and then, of course, most recently, the repeal of 8420 altogether under the whole government. So amidst these and other changes to abortion care in New Brunswick, there has been significant public disagreement among elected officials, providers, and even advocates as to the adequacy of and barriers to abortion care in the province. Prior to 2024, November 2024, Progressive Conservative Health Minister Bruce Fitch, who was the health minister at that time, maintained that there was no need to provide Medicare funding for procedural abortions in freestanding clinics, citing a lack of wait time for procedural abortion and easy access to mifepristone. The minister's conclusions were affirmed by the then interim CEO of Horizon Health, who stated, quote, "During the time that I have been interim CEO, I have not had any concern expressed to me personally with regard to challenges with regard to wait time or access." On the other hand, grassroots organizations, some providers, and researchers have continued to raise the alarm that there were still barriers to abortion access despite very notable improvements. Most recently, the newly appointed Liberal Minister of Health and former Horizon CEO, Dr. John Dornan, acknowledged that, quote, "We probably have missed people that should have had access." And so alongside these competing narratives about the barriers to abortion care and the ideal abortion system for New Brunswick, misinformation about the existing state of abortion care has continued to circulate. The presence of this misinformation is unfortunate, as a lack of clear knowledge about where, how, and what it means to have an abortion can frustrate patient decision-making and can cause unnecessary stress and anxiety. This presentation offers an exploration of some of the misinformation circulating about procedural abortion in New Brunswick. It involves presenting primary data from 12 interviews and 3 focus groups conducted during 2022 and 2023. These interviews and focus groups were conducted as part of a much larger project on abortion access, but misinformation emerged as a central theme in the qualitative data. The issue of misinformation in the abortion arena is not new, and it is discussed in a significant amount of literature, which I'll talk about. However, what this paper offers is an analysis of the types of misinformation identified through the qualitative research and also a contextualization of this misinformation against the backdrop of the long-standing struggle for improved access to abortion care in New Brunswick. What I'm going to do in this presentation is talk about, in addition to the problem which I've just presented, some of the history of abortion care in New Brunswick, a little bit about the literature that we draw on in order to advance our argument or exploration about misinformation. We're going to talk about the different kinds of misinformation that we learned about through our work. We're going to talk in depth about the sources of this misinformation. So why is this misinformation arising? And then we're going to end with a series of recommendations. Now, importantly, this work, in order to make sense of the misinformation, looks at feminist scholarship that critically engages with the gendered operation of noise, voice, and silence. So scholars such as Harlow, Parpart and Prashar, Armstrong and Bradley, and that, very importantly, consider silence as data. Scholarly conversations about abortion and silence have often focused on the silencing of abortion patients and providers amidst restrictive abortion legislation and the continued cultural treatment of abortion as taboo. And these are very important conversations, and certainly that's still going on around the world. This paper, however, And my presentation attends instead to how and when New Brunswick's government officials speak out about or refuse to engage with abortion amidst very public battles over access to procedural abortion care, significant changes to abortion policy in the past decade, and the closure of the only freestanding abortion clinic in the province. And so it's against this backdrop that we consider and really delve into the misinformation that we observed over the last few years. And so this presentation will proceed as follows. Like I said, provide a little bit of context about the literature this work is situated within and highlighting the issue of misinformation as noted by other scholars in the area. Real quick history, talk about methods because this is an academic talk, then really talk about that data on misinformation, get into the why, and end with some recommendations for change. So, as I'm sure many folks listening are well aware, there's an existing body of literature on abortion misinformation that analyzes the content, roots, and implications for people who want or who have had an abortion. The literature on abortion spans the natural sciences and the social sciences, with researchers analyzing misinformation as it is produced through organizations, including governments and pregnancy crisis centers, as well as misinformation held at the level of individuals. Scholars contributing to this body of literature use all kinds of methods and are very concerned with pinpointing the nature of the misinformation being circulated so that it may be stopped. Key themes of misinformation include physical and mental health problems for patients. So, this myth that abortion causes physical and mental health problems, the stigmatization of abortion patients, and more recently, a reemergence of a circulation of racist anti abortion conspiracy theories on social media, partially grounded in, quote, the Great Replacement Theory, a white supremacist conspiracy that people of color will replace white people as the majority. And this emerged especially in the period that we're now following the overturn of Roe v. Wade and amidst the very troubling rise of fascism that we are all currently witnessing and living through. And so, in essence, misinformation about abortion is still very much with us today and is arguably on the rise. And Pagoto calls this an infodemic. And so, this is what we are in, and this is what we are seeking to intervene into. So, before delving into data on misinformation in New Brunswick, it's necessary to provide a historical backdrop of some of the political decision making around abortion in the province that sort of foments this distrust. And so there's substantial distrust of the information and services provided by the provincial government as it relates to abortion in New Brunswick. And this distrust has emerged, at least in part, from a long history of anti-choice rhetoric or action from the province, as well as a lack of accessible information on publicly funded abortion options and what patients can expect. And so I've sort of laid out sort of three key moments just to provide a little bit of history. So prior to the Morgentaler decision in 1988, which fully decriminalized abortion, New Brunswick's hospitals, as was the practice throughout the country, offered abortions using therapeutic abortion committees. And Halffield publicly and privately promised constituents he would prevent Morgentaler from opening a clinic and that he would, quote, take appropriate steps to prevent any contravention of the established procedure, which was only permitted in so-called medically necessary situations. So it was only, quote, medically necessary abortions were provided. Hatfield also enacted a change to the Medical Services Payment Act, which threatened the medical license of any physician performing an abortion outside of an approved hospital. Now, following the Supreme Court decision in 1988, McKenna then promised Morgentaler the, quote, fight of his life if he tried to open an abortion clinic in New Brunswick. And while many abortion activists and pro-choice activists and advocates always sort of ruefully smile when we hear that, oh yeah, like McKenna promised Morgentaler the fight for his life. Obviously, for a man who had survived the Holocaust, whose life was threatened multiple times and whose clinics were bombed, and who was, like a Jewish man living in Canada in the 1980s, providing this necessary and vital service to folks who needed abortions. This, fight for his life from McKenna both seems ridiculous that would be the fight for his life, but also, highlights or hints at or ignores the real violence that Morgentaler had experienced. And then, um, the political parties in power, as Rachel Johnston says, um, often created deliberate barriers to access by keeping abortion within provincially approved facilities while espousing anti-abortion views. And so the distrust of these provincially appointed facilities did flourish, as we argue in the paper. Now, more recently, um, Liberal leader and Premier Brian Gallant um, promised to change Regulation 8420, and he did eliminate the two-doctor rule and secure provincial Medicare funding for Miffy Gyneso, which is great. But he did not uh, repeal 8420 altogether, uh, although uh, there were important changes and the ushering in of self-referral. But many felt that the failure of the Gillett government to repeal 8420 was something of a broken promise. And so there's sort of this really complicated history of distrust um, uh, of the provincial government when it comes to abortion care. Now, as stated, this paper analyzes data from a much larger study on procedural abortion care in New Brunswick. And so, data for this paper comes from 28 semi-structured interviews and 3 focus groups that included providers, other subject matter experts, advocates, activists, folks who've had an abortion, and other folks with like sort of a vested interest in the abortion arena, resulting in 43 unique participants, as well as significant documentary review of government reports, websites, and other great literature. And like I said at the beginning, one of the key themes that emerged from this data was misinformation. And it produced numerous references over transcripts from 3 focus groups and 12 interviews. And we organized these references into subcategories, which included the moral character of the abortion patient, health risks associated with abortions, pathways to access to abortion care in New Brunswick, and motivations of abortion providers in freestanding clinics. Okay. And that's what I'm going to talk about now. We're really going to get into the nitty gritty of the data that we found on that misinformation that has been allowed to flourish on abortion access in New Brunswick. And so, like I said, when we looked at all of the data from the interviews and focus groups, we noticed 4 key themes around which myths and misinformation operates. Okay, moral character of the abortion patient, health risks, pathways to access, and motivations of clinic-based abortion providers. And we're going to go through each of these in turn to really show you how those myths and misinformation operate. And then I'm going to talk a little bit about why. So, as reference to the literature review, there are assumptions made about who accesses an abortion and why. And a number of participants referenced the ongoing assumption that abortion patients are somehow irresponsible or deviant. However, this was not a dominant theme. It is certainly positive that the myth of the irresponsible, quote, flighty abortion seeker was not highly reported or reproduced by participants. However, if you look at the screen and you see 2 quotes, it is very troubling that this type of misinformation circulates at all. It's possible, of course, that the pathologization of abortion patients in New Brunswick is more widespread than the data collected for this work suggests, as participants engaged in this work had self-selected into a study about abortion care and perhaps are less likely to be surrounded by people who reproduce stigma about abortion patients. And so while it wasn't the dominant myth, it was present, which is deeply and profoundly troubling. So the second category of misinformation that we identified was around so-called health risks associated with abortions. And as a group, participants did not reproduce a lot of misinformation about so-called harms associated with either procedural or medication abortion. However, they did identify the circulation of misinformation among the general public. And unsurprisingly, the misinformation about the health risks associated with abortion care often mirrors that which is documented in a much larger body of scholarship on abortion misinformation that I kind of talk about a little bit at the beginning of this presentation. These points of misinformation included the characterization of abortion as unsafe, the idea that clinic abortions are less safe than hospitals, and the efficacy of the abortion pill or medication abortion. And so, for example, one participant who is not involved in healthcare provisioning did reproduce misinformation about the efficacy and safety of the abortion pill, stating, quote, "You have to weigh under 150 pounds for the pill that we use in New Brunswick to be effective. If you're over 150 pounds, there's no guarantee it will work effectively. And then sometimes it just results in birth defects." And this quote goes on. The researchers believe the participant was conflating emergency over-the-counter medication Plan B, not covered by provincial Medicare, with mifepristone. It is, and which is, and so you see this sort of this like conflation, and then this sort of like hyper, uh, really like problematic narrative about what will happen if you take these pills, especially if you have like a higher weight. And so that was troubling and was flagged. But as a whole, participants appeared to be knowledgeable about the general safety of abortion, but indicated a continued concern and identified a number of narratives about abortion safety circulating in the province. And so it's clear that in the province of New Brunswick, misinformation about the quote harms of abortion do continue to circulate, which is very troubling. The third myth we observed, and perhaps, I mean, they're all troubling, but this one, really stuck with me, was around myths around pathways to abortion care in the province of New Brunswick. And so you'll see like two quotes, but participants mentioned that they had heard a range of perspectives on how accessible abortion in the province was, from the idea that there was zero access to abortion in the province, which of course isn't true, through to the idea that access was good, or even that there was no way to access abortion at all. And so in this paper, we separated the discussion of misinformation into incorrect input about like legislation governing access, and then access itself. Unsurprisingly, what we found, and you can read the paper when it comes out, but there's a lot of confusion about the legislation governing abortion care, as well as the practical pathways to abortion access. Because there's been so much change to abortion policy in the province in the past 10 years, it makes sense that there's confusion. These changes, like I said, include the removal of the two-doctor rule, the extension of procedural abortion care into 3 hospitals, the approval of mifepristone by Health Canada, followed by the extension of Medicare coverage for this service, the highly publicized closure of 2 abortion clinics. So first, the Morgan Hillary Clinic and then Clinic 554. They occupied the same building. And the associated public debate about Medicare coverage for clinic-based abortions. And there has been significant public coverage of the withholding of Health Canada transfer funds from the province due to the ongoing refusal of, up until recently, of the legislation to repeal 8420. And so there was a lot of misinformation about the legislation governing abortion. So is the two-doctor rule still in effect? Is 8420 in effect at all? Is the province, quote, violating the Canada Health Act? There was all kinds of, which isn't sort of quite true, but that's kind of beyond the scope of this talk, certainly. Um, there were, there was a lawsuit going on. There was like a lot of information circulating about the legislation governing abortion. But there was also a lot of misinformation circulating that was identified by participants or even reproduced by participants about where to go to access an abortion. Some, like, that there was no abortion access in New Brunswick at all, or that the two-doctor rule is still in place, that there were these, there was that calling Moncton wasn't sufficient. There were all of these really intense and troubling narratives about how to access an abortion, that we saw, and that we were very alarmed. So it's both like the legislative confusion, but also the pathway confusion. It has been so the pathway issue, the access issue has been so significant that grassroots organizations like My Choice and Reproductive Justice New Brunswick have tried to like step in to provide a space, a site, information about how to access an abortion, to try to like correct some of the misinformation out there, because it has thrived in this environment of debate, of uncertainty, of change, and of, until very recently, sort of like a basically overly hostile anti-choice government. And so then the last piece of misinformation that's circulating that we identified was about the motivation of clinic-based abortions. And so, as stated, of course, there's only ever been one freestanding abortion clinic operating in New Brunswick at a time. So first Morgentaler and then 554. where patients can access procedural abortion care outside of hospitals or a hospital setting. And, like the Morgenthaler Clinic opened in downtown Fredericton in 1994. It closed in 2014. Um, Reproductive Justice New Brunswick and the Fredericton Youth Feminists crowdfunded over $100,000 to reopen the clinic, which led to Clinic 554. And amidst the struggle for freestanding clinic-based abortions, um, which was going on when we were doing this research, there was a lot of conversation about the motivation of abortion providers and the myths circulating about abortion providers operating freestanding clinics. And so I provided two quotes here on the slides. And the first one is that, quote, there was like this pro-life discourse that abortion doctors are just doing it for the money. Okay. And then the other one, it's always, I think there's this myth that folks who are providing abortions outside of hospitals are in it for the money. Okay. And so there's this sort of narrative being promoted about the motivations of clinic-based abortion providers as somehow greedy or problematic. Okay. And so this was the fourth sort of myth that we noted in our work. And in particular, during the Higgs government, there was this idea pushed by the government that Clinic 554, as a freestanding clinic that didn't receive Medicare funding to provide procedural abortion care, was a threat to the public healthcare system in New Brunswick. That the abortion providers were somehow undermining the public healthcare system by asking for Medicare funding for the services that they were providing. And while there is a whole debate about how to best provide healthcare services in across Canada, the treatment of Morgenthaler and then Clinic 554 as sort of distinct or different from a GP's office, which is also a private business, was disingenuous and really led to a lot of confusion about how New Brunswick's healthcare system and Canada's healthcare systems as a whole operate. And so, and really, created this narrative that private freestanding clinics were somehow threatening New Brunswick's healthcare system. And were, as I'm going to talk about later, quote, a slippery slope to privatization. It's troubling that abortion access in New Brunswick is plagued by misinformation. And of course, for abortion researchers, the question is why? Why is it, that we saw all of this myth and misinformation in the focus groups and interviews between 2022 and 2023 when there had been real important changes made in previous years? The elimination of the two-doctor rule, the rollout of Medicare coverage from mifepristone. These are huge gains, and yet so much misinformation persists. The answer, we argue, is best arrived at through an exploration of the issue of silence and noise about abortion care on the part of the provincial government. And this next section is structured around just that. First, I'm going to talk about the silences, and then I'm going to talk about the noises. As discussed, there has been significant shifts in the discourse about abortion in the province in the last 30 years. There can be a lot of anti-choice noise, openly fighting Morgenthaler if it's attempted to open an abortion clinic in the province. And while subsequent governments have not been quite so loud about anti-choice politics, truthfully, since McKenna, and there have even been leaders like Gallant who've advanced a more pro-choice platform, making pro-choice noise through his election promises, repealing the two-doctor rule and rolling out Medicare coverage for mifepristone. But while Higgs did go on the record as anti-choice, his tactic in the face of demands for improved procedural abortion access was to reiterate that the status quo was sufficient and to direct abortion advocates to the courts as the mechanism for change. And this active refusal to engage with abortion advocates, especially in face of the closure of Clinic 554, was governance through silence. Where there has been significant noise about freestanding abortion clinics is around the issue of provider motivations and privatization. And so the Higgs government weaponized the language of private clinics in response to demands for better procedural abortion care through community-based abortion clinics. Higgs called Medicare funding for procedural abortions a slippery slope if they were provided in clinics. and defended the decision to continue to disallow Medicare funding for clinic-based abortions, saying these clinics represented a form of healthcare privatization. And here's the quote. So if we're going to suggest that it is more cost-effective to offer services at a private clinic, then where does that stop? Does that mean that we should continue to offer more and more services in private clinics and less services in public institutions? It's a slippery slope. And if you do it for one service, where does it stop? Just 2 years later, his government amended the Medical Services Payment Act to allow for Medicare coverage for cataracts in private freestanding clinics. In terms of funding arrangements, there is not a difference between Medicare funding for procedural abortion in a freestanding clinic and the existing practice of providing Medicare coverage for vasectomies in physician-run clinics, or the recent expansion of Medicare funding for cataract surgery in a clinic setting outside of a hospital. It can be argued then that the conservative provincial leaders made a great deal of noise reproducing the narrative that freestanding abortion clinics are a threat to our public health care system, when in reality, these clinics have provided thousands of abortions, which has included thousands of dollars of pro bono work. The positioning of Medicare-funded procedural abortions in freestanding clinics as healthcare privatization produces significant misinformation about the operation of healthcare as a whole, and subtly positions freestanding clinic-based abortion providers as somehow greedy, rather than medical practitioners who are providing a publicly funded healthcare service, who want to provide a publicly funded healthcare service through their clinic. Additionally, when we talk about abortion providers for providing procedural abortion in freestanding clinics who at the time were asking for Medicare funding to cover those procedures, and the province was saying that that was a threat to the healthcare system. There is room for a conversation, of course, about how it is we want to organize our healthcare system. Do we want Medicare-funded services to be provided through private clinics, as it currently is? Your GP clinic, the vasectomy clinic, the cataract clinic, blah, blah, blah. Or do we want a different system? But it is not freestanding abortion clinics that are the source of that. And that is a much bigger question that was being leveraged to deny Medicare coverage for procedural abortions performed in freestanding clinics while allowing for cataract surgery in private freestanding clinics to be funded by Medicare. And so it created so much noise and confusion about how our healthcare system operated that hopefully has been cleared up or is being cleared up. In documenting misinformation and offering an analysis of how it persists and circulates, we come to the question of what must be done. And we do here want to reiterate the recommendations that we make in the Much Larger Project, which you can read about on the RJ Access ND website. We do want to underline that there's a very real need for a new information strategy. Information on how to access an abortion and what it means to have an abortion should exist in multiple languages, be plainly written, frequently updated, and exist both on and offline. Information provided must be accurate about the actual situation with relevant data on wait time, safety, care, and available resources. It should include information about both procedural and medication abortions, including how they work, where they can be accessed, and what resources you need to get to make use of them, gestational limits, and in the case of medication abortions, maybe perhaps which pharmacies regularly stock them. Resources must be made clearly available for those experiencing barriers related to finances, transportation, or housing that affects their ability to access either medication or procedural abortions. For access in New Brunswick to be complete, it must be certain. And that is a quote from the larger study. Certainty is made possible by having clear, concise, useful, and up-to-date information about where to go, what to expect, and how long a procedure will take. Until New Brunswickers are either directed to such a resource by official sources, such as a health authority, or that the health authorities themselves undertake to make such resources available, or the provincial government takes it on, the current information available is inadequate. Only once the information on how to get an abortion is accessible to all New Brunswickers, including those who do not speak English, those with lower literacy, those without access to reliable internet services, to folks who are precariously housed or unhoused, access is not certain, nor is it complete. Silence breeds misinformation and has been a powerful political strategy in a province where, despite some important changes to abortion, barriers have persisted. Similarly, noise about abortion that does not provide clear, accurate information about what to expect and what supports are available in the face of different barriers creates confusion, frustrates access, or makes accessing an abortion more stressful or challenging than it needs to be. In evaluating misinformation, the noise and silences that have allowed it to continue in this province, our work contributes to setting the stage for the next phase of abortion care in New Brunswick, where hopefully the noise that we hear from our leaders is one that is providing the necessary information and pathways that New Brunswickers need. Thank you so much for listening.